they get to hear me all the time. So thank you again. And we're going to have your two requesters, Deb Rosenberg and Mary Driscoll, to handle your introduction, and then later on Q&A. So Deb, you want to take it away?
Sure. And hi, so good to see you, Congresswoman Underwood. Yes, and we know you have a hard stop at 7 o'clock. So I'm not going to take a long time introducing you, but just to say that we're so pleased to have you, and particularly right around International Women's Day, which is in a couple of days. Everyone, I think, knows that Lauren is the Congresswoman in the Illinois 14th Congressional District, and in term number 3, and I was just, when I reread your bio now, just so impressed with the breadth of the committees and tasks. I mean, just unbelievable amount of breadth. And now you're also, I think, in the leadership of the Democratic Caucus in the House. So that's really exciting too. And so for Chicago Women Take Action, of particular interest to us, though we hope you're going to be willing to engage with us on a lot of issues, but really please start off talking to us about your really important work on Black maternal health. Several of us here, I myself am a maternal and child health epidemiologist, and there's other health professionals here on this call. So if you would talk to us about that, and even more broadly about health equity in general, that's a way for us to start, and then we can move on from there. So we're thrilled to have you. The floor is yours.
Well, thank you, Deb, and hi, ladies. It's so good to be with you tonight. I really appreciate the invitation. I hope you've all been taking good care of yourselves. This has been an interesting start to the Congress. Not quite the beginning that we all anticipated, but in many respects, the work is just beginning now. I'm having my first committee hearings this week, and we are really looking ahead to having a productive Congress. As you know, I serve on the House Appropriations Committee. I serve on the Agriculture Subcommittee and the Homeland Security Subcommittee, which will be important later on in my comments. But I'll just say, you know, I'm a nurse. The reason I ran for Congress is because of some promises that were broken around protecting healthcare coverage for people. And it's been really an animating issue for me to show a leadership role within the Congress, even without serving on a healthcare committee. And so it's been a lot of fun. At the time, you may have heard the story of how I came to take on this leadership role related to maternal health, but I went to graduate school at Johns Hopkins University, got a master's in nursing and a master's in public health. And one of my good girlfriends in my master's program was a woman named Dr. Shalon Irving. Shalon entered our master's programs with 2 PhDs already, one in sociology and one in gerontology. And she was, you know, just so smart and really focused and excited about having a career in health equity, but that's what we call it now. But at the time, she was focused on ending health disparities. After we finished our master's, she went on to serve in the U.S. Public Health Service Commission Corps. She was working for the CDC in Atlanta. And when I was wrapping up my service in the Obama administration, she was preparing to give birth to her first child, a beautiful baby girl named Soleil. Shalon did everything right. And 3 weeks after delivering her baby, she died due to complications related to high blood pressure. And I remember going to her funeral, and the director of the CDC came and spoke and said, I don't know how this could have happened. And that just stopped me in my tracks, because we know exactly how that happened. And I knew that, you know, if I ultimately decided to run for Congress and win, this would be an issue I wanted to work on. So let's talk about what's going on in our country. In our country, Black birthing people are 3 to 4 times more likely to die of pregnancy-related complications than their white counterparts. I believe in Illinois, it's 3 times as likely to die. And Native American moms, Indigenous people are at least 2 times more likely to die than their white counterparts. And then there's regional disparities where we certainly see disparities for Hispanic moms and AAPI people. And so for every death in our country, we have 70 near misses. We call that severe morbidity. And these are largely preventable. 80% of the deaths are preventable. in the United States of America. And because of these enormous disparities that we see, the United States leads the industrialized world in maternal death. And so it's only gotten worse due to COVID. There's obviously a really dangerous interaction between the virus and pregnancy for some people. And certainly Black and Hispanic moms have had worse outcomes throughout the pandemic. And so our maternal mortality rate has not improved over the last several years. It's gotten worse. In Illinois, the leading cause of maternal death is mental health, behavioral health, and substance use disorders. It's different than in some other states. And that's including the leading cause of death for Black moms, which, there is a belief, I'd say, in the Black community that the maternal death rate is not driven by mental health related conditions. And that's just not what the data tells us. So anyways, I came to Congress, quickly teamed up with Congresswoman Alma Adams from North Carolina, and we launched the Black Maternal Health Caucus, thinking it was just going to be the two of us, but it quickly grew to over 100 members. It's bipartisan, and we were just inundated with interest and activity from stakeholders around the country, insurance companies, provider groups, industry, people like Pampers and Huggies, and then you have tech companies like Uber and Lyft, and all these folks and this like community leaders were all interested in talking with us. And so we convened a stakeholder summit in the summer of 2019 and just listened in Capitol Hill, and we got some great ideas, and that was the origin of the Momnibus. The full name of the Momnibus is the Black Maternal Health Momnibus Act. It is 12 bills to comprehensively address our nation's maternal health crisis. It is exclusively focused on the clinical and non-clinical drivers that are contributing to the maternal mortality disparity that we see in this country. So things that aren't necessarily leading to death are not in the Momnibus, but are still very important. And the caucus works on those issues, but it's not in that bill. We also wrote the Momnibus so that it wasn't duplicative of other legislative efforts. So the postpartum Medicaid expansion, which we know is the single most important thing that we could do to save moms' lives in this country, that is not included in the Momnibus. Congresswoman Alma Adams from Congresswoman Robin Kelly from Illinois is the lead on the postpartum Medicaid bill in the House. And she and I work together on this issue, but it's not in our bill. So what's in the Momnibus are things like WIC expansion. So the WIC program, for example, stops at 6 months for mom and 12 months for baby. And in our bill, we're extending it to 24 months each. Why? Because we know that nutrition is an important part of saving moms' lives. And we have a social determinants for moms bill that also addresses housing and transportation issues that we also know are contributing factors to maternal death in this country. We have the Moms Matter Act, which is addressing mental behavioral health and substance use disorders. That one's bipartisan, and it's investing in growing and diversifying what we call the perinatal healthcare workforce. So this is maternal mental health care workforce. Why? Culturally in this country, we know how to tell the signs of postpartum depression, right? I think we all know what to look for in a daughter, a sister, a neighbor, a best friend. But when there is an anxiety disorder or a suicide ideation or an addiction involved, most of us don't know what those signs look like. And we certainly don't have those community-based resources and providers that are skilled in this postpartum period. We want to make sure that those providers are in every community in this country. And the data tells us that when the provider shares the same cultural background, same language, same race as the mom, the outcomes are better. And so that's why it's important to both grow and diversify that workforce. We also are trying to expand the technology tools. There's been a real explosion in apps and other interventions that are right now really concentrated to moms that can afford to pay for those services out of pocket. And so we want to make sure that that's available more broadly. I'm just giving you kind of an overview of what's in the Momnibus. But basically, there's the Justice for Incarcerated Moms, which is very important. The Federal Bureau of Prisons doesn't have the protections that you might imagine that they have. And so we're losing moms there. And then we were so proud in November 21 to have our Protecting Moms Who Served Act, which is helping our veteran moms that are served by the VA, making sure that they're not having disparities. I mean, they have disparities, so we're dealing within the VA to make sure that their needs are addressed, because this is what we would call a single payer healthcare system, and yet the disparities persist. And so we know that there is an intervention that is needed there. So one of the 12 has been signed into law. 80% of the rest was included in the Build Back Better Act that passed the House. It didn't pass the Senate. We were very close to having it included in the Inflation Reduction Act. And then when Manchin agreed to put climate in, he took the omnibus out. And then we came very close in December to having it included in the fiscal year 23 appropriations package. And the way I understand it, Mitch McConnell's staff scrubbed it out the last day when they went through and cut out everything woke. So we're still working on the omnibus. We have a new Senate strategy this year. Happy to talk about that more in QA if you like. But even though the omnibus is still in process, we are celebrating some big wins in that appropriations package. So I told you that I serve on the committee. Appropriations is, I think, an frequently overlooked opportunity for us to be able to bring tremendous resources to our communities. This is a bill that passes generally every year. Under normal order, it passes every year. And you can sometimes sneak in some policy changes in the appropriations bill if you know what you're doing. And so we got a really important pot of money, over $40 million for a new NIH initiative that addresses maternal mortality disparities. You might remember the former NIH director, Dr. Collins. He came to talk with us at the caucus, and you know me, I'm like, so what are you guys doing? And he's like, nothing, ma'am, I'll have to get back to you. And he actually did. And he set up a new initiative at our request and then funded it. And so now we got the $40 million to study what's going on with maternal mortality around the country. For the first time ever, we got some money for historically Black colleges and universities to do some maternal mortality research, which is very important. It creates a pathway for greater funding levels at these institutions. And then we are supporting some longstanding CDC programs. CDC is a really important agency to watch in this space because they issue grants to every state. So states like Illinois have two really important committees. The first is called the Morbidity and Mortality Review Committee. There is a maternal death in our state. Some of you may serve on it. I don't know, Deb, if you serve on it. Okay. And so, okay. If there's an instance of maternal death, this is the committee that does some investigation within our state. They put out reports around trends, what's going on regionally, et cetera, because as you know, our maternal death hotspots are not just Chicago focused. Take a look at what's going on in Peoria, take a look at what's going on in East St. Louis, take a look at what's going on in Rockford, right? And it's it's different dynamics regionally. And in some of these communities, there's only one health system, ladies. So it's not like you have a choice if you live in that community. And so these committees kind of review the deaths and work with the health systems. There's another important committee called the Perinatal Quality Collaborative. Illinois just happens to have the best, and we're trying to stand them up in every state. You got to have a carrot stick approach, right? You can't just be penalizing health systems when there's a catastrophic event. You have to work with them to improve the quality. And that's what this committee does. And so our caucus has been really focused on fully funding these committees in every state. We've been able to do that without having a bill, without having to do this little bipartisan dance. You know, it's bipartisan in that the Republicans vote for the bill and they don't strip out the funding, but it's not requiring someone to put their name on it and feel like they have to justify why they want to support these programs, right? There's a political dynamic here that is delicate, shall I say. And so we were effective at getting some really important resources in that funding bill. Last thing for you, Omnibus 2 is in the works. Omnibus 2 is going to be everything related to repro and maternal health and women's health that's not contributing to maternal death, but that has been under-resourced, under-researched, invested in. And so thinking about conditions like endometriosis and fibroids and polycystic ovarian syndrome, right? Thinking about stillbirth and miscarriages and some of the federal policy adjustments that are needed to accommodate some of these challenges, right? We know that there is a lot of work that's needed, but it's not necessarily leading to maternal death, but it's important and requires our attention. So we're busy. I'm really excited. I've mostly focused on the maternal health equity work. More broadly, you know, with this Republican majority, they're not interested in equity. They're not interested in woke. They're not interested in supporting programs that address these long-term disparities, and they're interested in cutting and repealing, right? And so our job is to navigate around that to make sure that we still have an opportunity to save lives and advance this legislation that we know is so essential for our communities. Thank you for having me.
Wow, thank you. And actually, I'm retired now, but I was part of the maternal mortality review committee a long time ago. So, you know, before we go on, and Mary Driscoll is going to, if people want to start raising their hands, Mary will help navigate that discussion. But I just wanted to tell you that before you came on, Congresswoman, some of us who have already read it, and we've put it in the chat, were just singing the praises of the article about you that was in the Washington Post. And just wondering if, before we go into questions, I mean, it was just an amazing article, and someone was saying you were amazingly brave to put yourself out there in the way that you did. So if you want to comment on that, you don't have to, but we just all thought it was a really terrific piece, and so interesting about women in particular in politics, and young women in particular in politics.
I'll just say I did the interviews for that article beginning in August. It was supposed to come out before the election, and it didn't. And there's been some time, and you know, a lot of people don't talk about what it's really like. And I'll say this is just my experience. I am grateful that after the election, we saw 2 more young Black women join us in Congress. Amelia Sykes from Ohio, who's like, she may be like 2 months older than me, but we're basically the same age. And then Summer Lee from Pittsburgh, who's a couple of years younger than me. And it's nice not to be the only one. And there's a tremendous sisterhood. I've been really inundated with, I say basically like every woman that I know has reached out in the last 48 hours, which is just extraordinary. But one of the people who reached out was one of my Republican colleagues who I have no relationship with. She and I are not, I've never talked to her, but she was just remarking on how the piece touched her and reflected some of her experiences too. And so I know it's not something that's just because I'm Black or just because I'm young or just because I'm from the Midwest. I think it just reflects a certain, we just need to improve what's going on in our country, the state of affairs for professional women and all women in the workplace really, but certainly in these types of executive positions, elite executive positions, it's pretty isolating and tough. But we're gonna make it and we're gonna win and we're gonna keep moving forward.
Great, thank you. Mary, you want to take over?
I don't see anybody's hand raised, and I don't see any questions in the chat. Oh, Dee, you have your hand raised. Go on. You're on mute, Dee.
I'm sorry, I've been looking for chat at the bottom of my screen. Hi, Lauren. I'm so proud of you, and I'm having my granddaughter coming in a few weeks, who's graduating from nursing school at the University of Illinois, and I'm going to tell her she should follow in your footsteps and get involved in all of the things. I was curious. I'm so sad about maternal mortality in our country because it's so stupid, and just as you say, it shouldn't be. 80% of the deaths are preventable. I'm just wondering how the strike down of Roe v. Wade is affecting what we're doing of women who are having stillbirths and women who are having issues with pregnancy. I've read that there are issues around this, that doctors are afraid to treat women because they're afraid that they're going to be hurt by bills that have been passed in legislatures. I wonder if you would speak to that a little bit. Thank you.
Yes. So, in this larger post-obs environment, it's dangerous to be a woman of reproductive age in many states, just because you are not seeking and what we would call clinically like an elective abortion procedure does not mean that you might not have a clinically indicated need for mifepristone, for example, which is the common medication abortion pill, or other surgical procedures for your health. And in many states, in any circumstance, women and birthing people are being denied the healthcare that they need because of these threats to providers and quite candidly, intimidation and threats to women. Part of the goal of the right is to restrict access to care through fear. Even if these laws on the books don't explicitly say, at 6 weeks, you can't get an abortion, right? If someone thinks that they can't get an abortion, they won't seek the care that they need. There are many, 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 many women in this country who don't have means and resources to travel. That is not a viable option for many people. And we are seeing the impact. We know that many of these states do not have the Medicaid expansion. So the postpartum Medicaid expansion that we passed through the American Rescue Plan and extended, states have to choose. It's not mandatory, it's elective. So while it can be permanent, so like Illinois now has a permanent postpartum Medicaid expansion, just because we have a governor and a legislature that are willing to do that. That gets to be important because if you live in a state where, let's say you have a stillbirth or have any kind of medical complication after your pregnancy period, your coverage can cut off 60 days postpartum, which is devastating, especially if you're in a state that already lacked adequate maternal health care providers, which in many cases, that is what we see throughout the Deep South and these states that are advancing these abortion bans. There's just this overlap between lack of access to healthcare resources and lack of access to abortion care. In the Black Maternal Health Caucus, we are very clear that there is nothing in the Momnibus related to abortion. This is not some backdoor way of federal funding abortions. I support repealing the Hyde Amendment and all the things, but that is not within the Momnibus. We have to be very, 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 very clear when we talk about this, because we need to get 10 votes in the Senate, 10 votes among Senate Republicans in this current dynamic, right? And so that's part of the nuance in the discussion, but we know that it's pretty devastating right now.
Well, I'm curious as how the Republicans say that they're against any provisions in this work. If as a matter of fact, you want, to have children born safely and this sort of thing, how could someone be against anything that you're proposing?
So there are some bipartisan bills, right? So the veterans one that was signed into law, that was bipartisan. Susan Collins was our Senate Republican lead. That was an interesting bill signing ceremony. I hope to work with her again on this issue. We have the Moms Matter Act, which is related to the maternal mental health conditions. That's bipartisan. And in the Senate, the bill related to technology tools is bipartisan. So, and the politics around Medicaid expansion in the Congress among Republicans has changed. It's not, you don't see the hard opposition like you do in some state legislatures. It's that sometimes the Republicans don't want to fund it, but they're not opposed to the policy, right? So like this intervention is $3 billion. We know how much it costs. $3 billion sounds like a lot of money because it is a lot of money. But when you think about how much we spend on some other things, this is a investment that will pay dividends, and it works. And when we improve the health and well-being for Black moms and Indigenous moms and other moms of color, rural moms, it improves the quality of care for all moms. And so it's something that touches every birthing person in this country.
So there's a question in the chat, Congresswoman Underwood.
Mhm.
People would like to know about the Senate strategy that you spoke of. You
Yes.
mentioned
So,
yeah.
you know, I think we learned from our experiences in my first and second terms that we needed to at least neutralize. These are my words, but we needed to, you know, move Senator McConnell to a neutral position, and some of the leading conservative voices, get them to a neutral position on the omnibus to allow for a pathway forward. What I learned from what happened in December is neutral is not enough. We need to get them to yes. To get them to yes in order to get our 10 Senate Republican votes. And so doing that is very different than what we've been doing to get the Biden-Harris administration on board, then to get Speaker Pelosi on board, then to get Chuck Schumer on board, right? It's a different advocacy strategy. And it doesn't mean it's harder. It just means it's different. And we have to spend our time differently. We're going to be traveling. We're going to be doing hopefully placements in different kind of press outlets. We're going to be leveraging some of our CEO relationships, right? Republicans listen to different voices than Democrats, which means this discussion needs to be had in different places than it has been. And because of who leads the advocacy work around maternal child health, think about organizations like the March of Dimes. You've never heard of a March of Dimes PAC, right? Because it doesn't exist. The March of Dimes doesn't do electoral work. There's nobody in the political space that does this work, which means we need to do it ourselves. And so I'm doing it myself. And it's hard to do that and run for re-election and have my leadership role and be on my non-healthcare committees and all of this stuff, right? But we are formulating this plan now. I don't know exactly how we're going to do it. You know, setting up a new PAC or a new organization is tough. That requires a lot of, I mean, it's not free, let me just say that. And so we just need to figure out how, but I am deeply committed to this work. I want to get it done this year, and I want to travel. We need to change the strategy. I think you all sort of get where I'm going here. We need to change up the tactics to be able to do what needs to be done. Mary, you're muted.
Okay, there's another question in the chat. Actually, we have all been hearing that maternal mortality in states with abortion bans has increased. So is someone collecting the data about that and looking at that data?
So again, we get data on an annual basis. And then it typically takes 2 to 3 years for CDC to report that data. These abortion bans have been on the books for 6 months in many cases. So what we do know is that some of our partners have data. The insurance companies have data, right? You know, think about some of the proxies that would know if there's a maternal death in the community. They know, and there can be more articles, but the actual statistics we don't have yet. And for us, we know that these issues are important because they relate to the same population, but the solution to an abortion ban is not the omnibus. And we have to be very clear about that. The solution to an abortion ban is to pass the Women's Health Protection Act and to get rid of the filibuster, right? And make sure that President Biden will sign the legislation. And so, you know, we just have to be really disciplined about how we talk about this.
Get it. Okay, so I see some hands raised. Jackie Grimshaw has her hand up. Amelia has her hand up. Betty, do you have your hand up? Someone, yes, okay. So Jackie, you want to go first, then Betty, then Amelia?
Sure, thanks a lot. Congresswoman, as you talk about the a little bit more bipartisanship as it relates to these omnibus bills and maternal health, and you know, some easing of the anti-Medicare, what is the attitude of your colleagues in House and Senate about, you mentioned increase in funding for WIC in terms of children as well as moms. So with these abortion bans, is there any consideration that if we have all these babies that would otherwise have been aborted, they're now live babies, are they willing to support more funding to help moms who are in need have the food that the babies need, as well as nutrition for themselves?
I do not have a discussion in that way.
Okay.
I would not advise a discussion in that way. I think it's important for us to remember that at a federal level, we are not passing federal bans on abortion. And given where the advocacy is needed, which is in the Senate, the Democrats are still in charge of the Senate, right? So we're not looking for the entire Senate Republican caucus to support this bill. We're looking for 10 Senate Republicans to support this bill. And there is a difference because there are many Senate Republicans that come from states that did not pass abortion bans. You see where I'm going here? So there's a group of people who may, on some level, share some values. That value may not be around access to abortion. That value may not be around ending disparities, but maybe they care about global hunger. Maybe they represent a significant agriculture community, right? Maybe, you know, maybe their best friend runs a food bank. You know, it could be whatever reason people sign on to stuff, right? It's our job as advocates to identify what motivates those individuals. But I can basically guarantee you that a conversation around in that way would not be productive. Yes, ma'am. Thank you.
Betty, do you want to ask your question?
Yes. Congressman Underwood, I'm wondering, I signed a petition today based on what Walgreens did across the country with the abortion pill. Is there anything the Senate or the president can do with regards to large corporations just deciding willy-nilly not to send pills out, not to fill prescriptions?
You know, we've seen the Biden administration clarify the legal environment to outline that there is, you know, what federal law says, which is the FDA has said that mifepristone and medication abortion is safe and effective and able, and, you know, should be available to the public. And certainly in states like Illinois that maintain access to reproductive health care, it is our expectation that a company that is interested in making money would continue to offer products that has a consumer demand. Okay, and so this is why it's important that we have competition in the marketplace. And it's also important for women of reproductive age to be savvy consumers. And it's important for those, I mean, we cannot expect a corporation or anybody in this environment to be benevolent. Walgreens is not going to do something for us. They're going to do something for themselves, right? And I think this is an important lesson. I think that there's probably a legal strategy. I am not having those conversations. But there's a lot of people who believe in corporate social responsibility, and I think we have seen a corporate bad actor in this instance.
Amelia, do you want to ask your question?
Thank you.
Hi, Congresswoman. I just want to introduce myself. I actually was a youth fellow on your campaign when I was in high school.
Thank you.
Of course. And now I'm in college and I'm studying political science. And you are just the reason that I am. You are my biggest role model inspiration. I just wanted to say thank you for being such a big part of my life. And my question is, what advice do you have for a young woman who is hoping to make a career in politics?
Well, Amelia, I think you can do whatever you want. The hard part is just deciding what it is you want to do and in what order you want to do it, because it's okay to want to do multiple things. And my best advice to you is a few things. One, I have no doubt that you are savvy on the internet, but just keep an eye out for what will permanently live online about you, should you decide to run for office one day. My second piece of advice is to, if you decide to run for office, run for the job that you want and the position that your skill set is best suited for. A lot of people do this like position hopping. Oh, I'm going to start here and then run for that, and then I'll be well positioned to do something else later. Like, no, these jobs are hard and they need people who want to do the job in those positions. And so, do that. And then public service, I think, is a calling, and it takes many forms, and be open to unexpected opportunities to serve. And if you do those three things, and always negotiate your salary, always. I don't care what they tell you, they can always move. Emma's heard this before. She will tell you, I believe it in my heart. Negotiate in the first conversation. Ladies, you all know this, but Amelia, I don't know if anybody's told you, but when they call and offer you the job, that is when you want to have the conversation. Do not hang up and then try to call back because you've lessened your negotiating power. You have the power. In this market, you have the power. So be negotiating. And start at the beginning of your career. That first salary is very important. Because you can't run scared and you can't run broke, right?
Yes, thank you.
You got to
so
get this money.
Thank you.
Okay.
Am I missing? Is there anyone else with their hand up?
Yeah, there is another question in the chat, and I guess I'm elevating it because I'm interested in it too, which is, Congresswoman, could you talk, now that you're in leadership in the Democratic caucus, tell us sort of what does that mean? Like, how does it involve influencing priority setting, I guess, or other kinds of strategizing and working with the other leaders of the caucus?
Yes, thank you. I was elected by the members of the House Democratic Caucus to serve as a co-chair on our Policy and Communications Committee. And under Leader Hakeem Jeffries, our responsibilities include like the daily message. So what are House Democrats talking about day to day? We do some convening. We bring folks together every week. So like recently we brought in Anita Dunn from the White House ahead of the State of the Union to talk about how we can amplify the president's message. And then we do some internal caucus related work. My project is what I call leveling up our digital operations. So you might have seen that some of our favorite in-person members of Congress have virtually no online presence. And all of us are basically living in a digital first environment where we cannot neglect the opportunity to engage with our constituencies online. We need to be better. Digital does not only mean social media, as we know. And so we do some coaching and work with individual member offices there. I also am part of the leadership team, which means like since I won, we added probably like 4 or 5 meetings a week, including several meetings with Hakeem, where we talk about basically everything. And so that's the strategy part that you referenced, Deb. But, you know, it's been fun. I can certainly tell how no Black woman since Shirley Chisholm got elected to the House Democratic Caucus, because even though we share values, there are some very challenging dynamics at play in our caucus. And so, you know, I want to do a good job and make sure that it's not another 40-year gap, right? Or more than 40 until somebody else is elected. I guess I should say Jasmine Crockett is a new member from Dallas. She replaced Eddie Bernice Johnson, and she was elected by her class to be their representative to leadership. So hopefully we have a little pipeline coming of women of color serving in these positions. But we're in charge with the message. So I know people get really frustrated, like Democrats have no message. I will just say this. There is a tactical decision that is made to not always have everybody punch back at the Republicans. We all may not agree with it. I recognize that. But right now, you know, this message of democratic unity, that is our message. We are unified behind the president. We are unified together to advance this agenda to help working families. Republicans are chaotic. Republicans are corrupt. Right, we're drawing this sharp contrast with these Republicans. And that might seem really basic, but we need to bake that in. And so that's what we're working on right now.
Anyone else have any other questions? Okay, well, I will take a stab at one question. So where are we at with the implementation of 401B pricing for Medicare? And where are we at with the potential of expanding that to all people, not just those
401B pricing, meaning the negotiations?
A 301B. Yeah. Where are we at with, I mean, didn't we pass that for Medicare? That for people on Medicare, that they're going to be able to get the pricing? And where are we at with that? How are we going to implement that? And then what about expanding that? What's the potential of expansion of that to everyone?
Okay, so
lowering drug pricing, basically.
yes. Okay, so as you know, the provisions that we passed last summer are being rolled out in a staggered basis. So what went into effect this January was $35 price cap for seniors who have Medicare who require life-saving insulin, right? And so that is what's happening this year. And so the drug price negotiation has to go through a regulatory process. So that takes a couple years. And so the Department of Health and Human Services is working on those regulations now. And then once they are finalized, it will be available to all Medicare beneficiaries. But I think that one starts in 2025, but maybe Emma can put that in the chat for us just to put a finer point on it. In terms of the insulin costs for everyone, you know, we got 57, I believe, votes in the Senate to allow the insulin cost to be available for everybody. We didn't get the 60 votes that we needed. And so they're still working on it. But at the end of the day, we need to win elections. We've got to win these elections, and 24 is a big year. And I believe that we can hold the Senate and even pick up a few seats, just like we're going to get this Democratic majority back in the House.
Thank you. So I see 2 more questions. That's probably just about all we have time for. So Carol Levine and Kathy Tholen both have questions. Carol, do you want to go ahead and ask yours?
I'll be very, very quick. It's more both a thank you and a statement around something that's been said. First, Lauren, I just want you to know that I think the planning on the omnibus bills to separate them from all of our work on abortion rights, and those issues is as smart as it could be. They are the way to get progress is exactly what you're doing. And I think as much as I work very hard on reproductive justice, I totally support your drawing that line and building that wall, because I think it's the only way we're going to get what we need. So thank you for that. And we'll be there to support you on that. I think it's really important. I wanted to say, I had a conversation yesterday with Lori Chayton, who is the lead lawyer on the abortion issues for the ACLU. And we talked about, for a few minutes, about Walgreens. And she said to me, she said, you know, they don't even distribute those pills. They aren't even in the business of distributing that at this time. She said, so this was just a statement, a political statement from them. And I think people need to know that, because, you know, I'm in the midst of saying, do I need to take all my business out of there and go elsewhere? And I think we just need to know that this is political posturing, and that's all it is. And so that's just something to know from someone who's in the midst of all of this litigation and does know. And you know, we'll do what we do.
Thank you.
Kathy, then do you want to go ahead? You'll be the last question.
And so that's my question. I read that article in the Washington Post, and I am very happy that we were able to help you deliver some, many of us were able to help you deliver a wider win in the last election than you had before. And I want to know if that means you get to take a vacation.
No vacation has been scheduled, but thank you for all your help, Kathy and friends, knocking doors and visiting us on the 14th. You know, I'm doing all right, everybody. I think that some people read the article and think I'm like about to quit. This is not me saying goodbye. This is me saying I'm not going to do this forever the way that I have been doing it. But, you know, we're going to keep winning, and we're going to keep making progress, and hopefully doing it in a way that makes it easier for the next red to blue and frontline person that comes along as we reclaim and grow our majority, right? Like, it's just unreasonable what's required, you know, in order to win, I think, personally. But we can make progress on that and help others. So that's what I'm committed to doing.
Thank you so much, Congressman Underwood, for coming tonight.
So thank you. We are going to be there, as Jerry says, on the outside, you know, helping push your work on the inside to fruition. So thank you very much, and come back anytime, or just let us know if we need to do something else with this plan that is not aggressive enough. So we're here for you. Thank you very much.
Thank you. Continue to take good care.
All right. Bye-bye.
Bye.